Good morning, everyone. I am Nancy Naji. Welcome to a series of Moneyline with Nancy specials examining Nigeria's response to the outbreak of the coronavirus pandemic. Today, I will be joined by leaders who shaped the policy thrust, response measures, and handling of the pandemic, and a cross-section of Nigerians whose lives were changed and affected. We will analyze the data, the details, the wins, and the failure. Joining me today is Dr. Adeyemi Dipeolu, the Special Advisor to President Muhammadu Buhari on economic matters. Dr. Dipeolu, good to see you and welcome to the program.
Thank you very much. Thank you very much, Nancy. Good to be here.
Good to have you. Joining him also is Dr. Chikwe Ihekweazu, Director of NCDC, that is Nigeria Center for Disease Control, also a key member of the Presidential Task Force on COVID-19. Dr. Chikwe, welcome to the show.
Nancy, good morning to your viewers. It's great to be back on your show today.
Thank you for joining us. We will hear from them in a moment, but first let us take this report from our correspondent, Emmanuel Audu, as you also join us on all our social media channels by following us and sending your questions and comments with the hashtag COVID 1 year on.
The COVID-19 pandemic in Nigeria is part of the worldwide pandemic of coronavirus disease 2019 caused by severe acute respiratory syndrome, coronavirus 2.
The virus, which originated from Wuhan in China at the end of 2019, has infected over 113 million people and led to the death of over 2.5 million worldwide.
The first coronavirus case which was announced in Nigeria was on the 27th of February 2020 when an Italian citizen in Lagos tested positive of the virus.
On the 9th of March 2020, the second case of the virus was reported in Ewekoro in Ogun State of a Nigerian who had contact with the Italian citizen. Since then, the number of the cases in Nigeria have grown, with Lagos being the epicenter of the pandemic in Nigeria. On the 23rd of March 2020, the country recorded a first death. As a way to coordinate and oversee Nigeria's multi-sectoral intergovernmental efforts to contain the spread and mitigate the impact of COVID-19 pandemic in Nigeria, President Muhammadu Buhari on March 9, 2020 inaugurated the Presidential Task Force on COVID-19 headed by the Secretary to the Government of the Federation, Boss Mustafa. However, it is heartbreaking to note that some prominent personnel have been killed by a deadly disease. Efforts by the World Health Organization and federal government of Nigeria to contain the spread of the virus includes wearing of face masks, washing of hands with soap and water, and the use of sanitizers, social distancing, phases of lockdown which led to interstate travel ban. Offices, clubs, and services considered to be non-essential were closed. Meanwhile, one of the major response from government is the 500 billion naira COVID-19 Crisis Intervention Fund and enhanced support to states for critical healthcare expenses. No doubt, COVID-19 pandemic in the country affected the livelihoods and food security of smallholders, especially poorer households. However, the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development was tasked with implementing palliative measures across the country. Some include the disbursement of 4 months grant of 20,000 naira to the poorest household in various states, donations of food items to state government for onward distribution to citizens. It will be recalled that on the 10th of December 2020, the Secretary to the Government of the Federation, Boss Mustafa, said the second wave of the pandemic has begun following the increased number of COVID-19 cases detected in the country. As Nigeria and the world at large becomes more disturbed with continuous increase of COVID-19 death cases, World Health Organization, in partnership with scientists and global health organizations, commenced work on producing vaccine in order to provide acquired immunity against severe acute respiratory syndrome coronavirus 2.
It will be recalled that earlier this month, 10 vaccines were authorized by at least one national regulatory authority for public use, while Nigeria's National Agency for Food and Drugs Administration Control approved the Oxford AstraZeneca vaccine for use in the country, as the vaccine is set to arrive in the country in the next couple of days. Emmanuel, I will be reporting for Moneyline with Nancy.
All right, welcome back. Let's get started with our conversation. Dr. Adeyemi Dipeolu is with me, as well as Dr. Chikwe Ihekweazu. Dr. Ihekweazu, let me start with you by asking you, the last time we spoke, you came on my show on the 5th of February 2020. That was just some days before the index case arrived Nigeria. In your own opinion, what's your personal reflection since then, a year later?
Wow, Nancy, I honestly can't even remember I came. The year has flown by. I still remember the night before the first case. The weeks preceding that, we had been working intensively with labs to make sure that if we did have a suspect case, we were able to make that diagnosis. Labs across Lagos and Abuja were briefing the public. I was briefing the Honorable Minister of Health, who was briefing Mr. President. So I remember the very first, the night before the 27th. So on this day, before the 27th, when we found our first case, we had a series of cases that turned out negative. But finally, I think it was Professor Milabu, actually, in the University of Lagos, that called me and said he'd seen a signal and he thinks that we do have our first case. We walked through that night and eventually it was confirmed to be a case. It was reported. I reported to the Honorable Minister that night. We walked through the night to have a press release ready for Nigerians the next morning. And since then, literally 12 months later, we haven't rested for a single day. We've intensified the response. We started from a very difficult base. We were very open with Nigerians in terms of where we were. But I think most people would agree that the doomsday scenario that was predicted by many that would befall Nigerians hasn't happened. We've had a bad outbreak, part of a global pandemic, no doubt about that. But I think on reflection, we've mounted a robust response from Mr. President up. I think the institution of the Presidential Task Force, led by Mr. Boss Mustafa, and the leadership he has exuded in the country, bringing together the multiple sectors responsible for the response. And the fact that Mr. President has taken every single advice that we've offered. Mr. President listened to the science, followed the science, and the Presidential Task Force executed the delivery of that through the various agencies of government.
Okay.
So I think, finally, Nancy, on reflection, this has been a difficult 1 year for everyone, no doubt.
Okay. Okay, Dr. Dipeolu, let me come to you and ask you this question. Why you think that some people in the country still think that COVID-19 is a scam and is about financial gains for some people and government officials? That question is for Dr. Dipeolu.
Thank you very much, Nancy. I think I'll take up from where Dr. Ihekweazu ended up, which is that even the very leadership of the country has listened to the science, has followed the science, and has allowed solutions to that problem to be driven by the science. And I say that because to deny that COVID exists is to, I think, disrespect the memory of people who have been killed by that virus. I think it's to disrespect the experience of those who have been infected by the virus. And I think it's imperative that we all realize that Nigeria is part of the world and COVID-19 has taken so many lives worldwide. And I think our experience, while not the worst, is certainly been something that should give all of us pause to accept that COVID-19 is real and its impacts on our lives is very, very real.
Okay, Dr. Ihekweazu, what in your own assessment is where our health system is right now, which was hitherto broken down with inadequate facilities? Because the fear of most of us, even at the beginning of this pandemic, I remember on the show, December 2019, I talked about it, that there was a new virus in China, that was 2019, that we should take heed. And I interviewed you on the 5th of February, 2020. One of my fears then was about the health sector. What is your assessment of our health sector right now?
Nancy, thanks for that. You know, that everyone knows, and we've said this separately on your show, you know, the challenge we have in Nigeria of a multiplicity of challenges from security to infrastructure, power. You know, the health sector really, until the beginning of this outbreak, didn't rise in terms of sufficiently in the recognition that we gave to it, not just as government, but also as people. You know, if you ask the average Nigerian what was important to them, I don't think anyone would have mentioned any aspect of the health sector prior to 12 months ago. So this is really a wake-up call for all of us, that the health sector is probably the most important in our existence. You know, you can only enjoy power, telecoms, infrastructure, security if you're alive. And so we've got to really rethink what our priorities are across government, state, federal, local, across our population, across civil society, and really place the right emphasis on this. And I think government has realized this. You know, yes, we started from a very low base in January, but in the area of work that I lead on health security, on developing our laboratory architecture, our surveillance systems, emergency operation centers, you know, government has really supported us in scaling all of these. The challenge I see, Nancy, is that the underlying requirement that we need in the long term is developing our scientific abilities. So science is the underlying element needed to train the people that are required to protect our country in the long term. So we can't see this as a sprint. This really is a marathon. And we need sustained investments in health security. And realizing that, you know, even if we don't see big buildings emerge out of this, that the investment in people, in reagents, in the science that really is required is so critical so that we can sleep at night. Nobody wants a big outbreak like pandemic like this. We really want a situation where there's a small cluster of cases somewhere in Benue State, in Bayelsa State, in Sokoto, that we have the expertise that can go there, make the determination of what is going on, respond locally, and prevent outbreaks. And to do this requires a prioritization within government, prioritization within people, and investment in the resources required. Okay. This is an existential challenge for us. Health security is a national security issue, not just a health issue, and has to be awarded that level of prioritization in our decision making.
Dr. Dipeolu, you know, even in the heat of the lockdowns, the debates between saving lives and livelihoods were on worldwide. With what we even saw in Nigeria, did you think that the debate on livelihoods held sway against the saving lives conversation? Because during that time, Nigerians were saying, please don't lock us anymore. Hunger would kill us than the disease. I've not contracted COVID, so why lock me in my house?
I think we must, first of all, accept that it was a very, very difficult situation and a very, very difficult decision to lock down. Because it is true that many, many millions of Nigerians earn their daily bread, daily. In other words, they have to go out daily to earn the money to feed their families. They have to earn the money to be able to sustain their livelihoods. So I think it was very important to realize that a lockdown would have affected very many of our people. But I do think that one of the reasons why we haven't, or why we were not so badly affected in the initial stages was the fact that by locking down, we helped to reduce the rate of transmission. So not perfect, and of course, everybody infected was not something ideal. Everybody who had passed away is not something ideal. But I think we tried very hard to find that balance. Of course, first of all, trying as much as possible to restrict how much had to be locked down in the whole economy, and then moving very quickly to try and give support to people during the lockdown in various ways. So it was a difficult one. It was one that challenged policy makers. But I think by and large, once we were able to begin to focus on non-pharmaceutical interventions, social distancing, wearing of face masks, sanitizing, then it became easier to begin to ease the lockdown and save lives while allowing economic activity to go on.
Okay, Dr. Ihekweazu, people are tired already and are experiencing what I call COVID-19 fatigue or the pandemic fatigue. I'm actually also fatigued somehow in terms of I'm always apprehensive that when I want to go out of my house, one of my accessories now, which is a basic health item, is a mask. So the question on our lips right now is, when will this be over? And is the worst over yet?
Thanks, Nancy. You know, it's been a tough year for every Nigerian. You know, this is really, and I think it's been tougher for Nigerians than any other country in the world because of how we are, right? We are social people.
We're happy people.
Yeah, we want to be together,
Wonder people.
Dance, pray together, eat together, and this has really restricted our ability to do any of that. We have to cover our faces. So even we can't see how beautiful Nigerians are. So it's very difficult. It's been a tough year. But I assure you, the alternative is a lot worse. So right now, I think we are at the beginning of the end, but we are not there yet, right? We hope to get vaccines into the country in the next few days, literally. It will not lead to an elimination of the public health measures because it will take some time. That 200 million Nigerians, it will take some time. Even if we had the vaccines in today, it will take months to reach every Nigerian that needs to get this vaccine. So we need to persevere to some extent, continue these measures in order to have a better and brighter tomorrow. So really, this is a message to all Nigerians. Like, you know, we feel your pain. We haven't rested for 12 months. You know, Christmas, Salah holidays, healthcare workers have had to continue working to save lives, to save Nigerian lives. And we need the collaboration of every Nigerian. And that's why the theme of a lot of our campaigns have been to enable individuals to take responsibility. Like my brother said earlier, the lockdown was a very difficult decision for our country and for Mr. President. I am grateful that I wasn't in his shoes because, you know, you see the data coming from NCDC, obviously, but he is privy to data coming from export earnings, from taxation, from security forces. He must have had an incredibly difficult task weighing up these different sources of data and making a decision. But from the very beginning, I think we were all clear that the lockdown wasn't sustainable and we had to rely on the support of Nigerians in order to carry out these measures. And I agree with him as well. I think we've been fairly...
Okay. I'll come back to Dr. Ihekweazu. The network seems to have frozen there. Dr. Dipeolu, what was and still is the cost of this pandemic? You know, when we went into the lockdowns or when the first case arrived in Nigeria last February, the economy had come out of a recession of 2016, but we just had a fragile growth. And if you take a look at 2020, we were in a contraction, we experienced a recession, we came out again the end of 2020 from that recession. What do you think has been the cost of this pandemic?
Thank you very much. I think first and foremost, we can see that the cost of the pandemic in various ways. The first way, of course, is in the broad growth figures. You remember that the economy fell in the second quarter of last year by over 6%. And in the third quarter, it fell again by another 3% before rising marginally to 0.11% at the end of the fourth quarter of last year. So in terms of general growth, there were costs. There were costs also in terms of job losses. Many people lost their jobs because their businesses had to close down. Many people lost their jobs because, as I said, a lot of them work daily. Some of them are casual workers, and what you are paid depends on what you work, how much work you've done. So there were costs in that, but there were also costs across sectors. There were costs affecting for instance, what I would call the hospitality industry. Hotels had to close down. Restaurants had to close down. So there were major costs around that area. There were costs across nearly all sectors, some falling as much as minus 20%. There were costs in the retail sector. The footprint, for instance, going into, I use that as an example, Jabi Mall, fell by over 75% in the period of the lockdown. So overall, there were severe costs to the economy, business failures, and job losses in addition to, of course, difficulties of earning a livelihood. So I think, indeed, we felt the impact pretty much across nearly all sectors. Aviation, of course, you know.
Okay, Dr. Dipeolu, just a follow-up to that. We saw an array of government responses towards combating the pandemic through regulations from different agencies of government, fiscal as well as monetary measures. Were those measures enough? And has the government evaluated if from, or in the past 12 months, if those responses have really gotten to households, to SMEs, and to businesses that were in need of that support? Because a lot of Nigerians will say, we hear money on TV, we see that monies have changed hands in newspapers, but it hasn't gotten to us.
Okay, I think the first thing to say is that, first of all, there was a coherent response in the sense of the economic sustainability plan drawn up by the Economic Sustainability Committee appointed by the president, I think at the end of March last year, to begin to think of how precisely to save businesses, save jobs, and render assistance to Nigerians. So that plan was coherent. And because of that plan, I strongly feel one of the things that the plan did was to enable the government to stimulate the economy by maintaining planned expenditures, even though revenues had fallen. Oil prices fell, I think, to as low as $14 per barrel at one stage. So just that ability to be able to maintain government expenditure and therefore to put money in hands of people was critical. But I think also it's important to stress that there was a lot of support given to micro, small, and medium enterprises. So you had a target of maybe 500,000 people, just employees of small businesses, giving support. But you also had a lot of support given through the social investment programs, whereby palliatives were given to people, but also the conditional cash transfers were extended to people. So, but ultimately, our responses, of course, were tailored by our own fiscal limitations. So it's a country of 200 million people, and it's with a budget that is only about 8% of gross domestic product. So it was essential to try and prioritize, try and support sectors that were badly hit, try and support individuals that were badly hit, and hoping that the multiplier effect would then begin to help lift the rest of the economy. And I think just the fact that in October, in the fourth quarter of 2020, despite losing almost the whole month to NSARS and the illegalism that followed, we were still able to record a 9% increase quarter on quarter between the third quarter of 2020 and the fourth quarter. I think points to the fact that things were beginning to improve, still realizing, of course, that there's still a lot more to be done.
Okay, Dr. Ihekweazu, let's talk about vaccines, which you talked about earlier. In how many days are the vaccines going to come in, and which vaccines specifically? Is it Oxford, AstraZeneca? Yesterday, I got the news that J&J, US FDA has approved J&J and J&J vaccine. J&J vaccine is just one jab. So speak to us, when exactly these vaccines will be coming into Nigeria, and if you are indeed concerned and worried about vaccine availability or vaccine hesitancy, because some Nigerians have said that I'm not going to take the vaccine.
Thanks, Nancy. You know, the federal government of Nigeria, through the lead agency, the National Primary Healthcare Development Agency, has been working extremely hard over the past few months. You know, sometimes when you're building, like a new building, you don't see the building until it arises. So what they've been doing is really do all the due diligence from regulatory aspects through NAFDAC to logistics to distribution, preparing for the availability of these vaccines. And we're excited that those vaccines will be getting to Nigeria in days, literally. I can't tell you an exact day because it's a little bit outside of our control, but those vaccines, I understand, you know, a couple of millions of them are coming in soon. We will be using the Oxford AstraZeneca vaccine. That's the initial one available to Nigeria through the COVAX facility. That you know, will go a long way in starting this program that will last for months. We're going to prioritize healthcare workers first. And you know, there's no more important group than healthcare workers in terms of this response. It's like, you know, when you're fighting a war, you make sure your military is ready. In this particular war, the most important group are healthcare workers. So they will be the focus of activities, and then we'll go to other priority groups across the country.
Do you have an idea of how many vaccines we're expecting?
I don't have an exact figure, but all of that will be available soon. We've been burnt a few times, so we're very careful in giving out precise information, but I really want Nigerians to rest assured. In the next few days, the vaccines will be in country. All the information will be made public, and we'll be able to start the actual vaccination. Because it's not the vaccines in a warehouse that will save lives. It's the getting vaccines into the arms of people. And Nancy, to your second question around some assumptions around people willing to take this vaccine, you know, our polls, we've been polling Nigerians fairly frequently through our sister agency. And, you know, the polls really say that most people are really excited about the vaccines and are waiting to get vaccinated. The other thing to remember is that over 220 million people worldwide have now received the vaccine. So all the kind of theories and stories going around about something targeting Nigerians or Africans, you know, Africans are waiting for the vaccine. We haven't even gotten them yet. So the key thing really is, you know, we are excited about the prospects of returning to some form of normalcy. Our ticket to returning to a strong economy, a vibrant lifestyle, to the Nigeria that we want to live and experience again is through these vaccines. There's no alternative pathway. And the exciting thing, finally, Nancy, is from data coming from other countries that have had the benefit of earlier introduction of these vaccines into their countries. They have seen a radical reduction in the number of new cases, number of hospitalizations. In the UK, schools are about to open for the first time in months. So, you know, evidence from around the world has shown the enormous impact, valid impact of these vaccines on populations. And that's really what we want to see happen in Nigeria in the next few weeks and months.
So what we should be concerned in Nigeria is not about vaccine hesitancy, but vaccine availability. And when we're talking about vaccine availability, we're talking about also the money to purchase those vaccines. Dr. Dipeolu, let me come to you. I think yesterday also my finance minister did say about over 700 billion will be added into the budget as supplementary budget to get vaccines into the country. With our fiscal space right now, I know that we got a lot of assistance from even multilateral organizations, and I must also give credit to the private sector that helped also the federal government with this, the COVID guys and the women. They were not only guys. What do you think, or where do we stand right now on that?
Thank you very much. I think the latest information is what you have from the Minister of Finance, that we will be going to the National Assembly to seek supplementary appropriation to pay for our own share of the vaccines. I think it's important to realize that, and Dr. Ihekweazu knows it better than me, that the vaccines are coming from different streams. There are those that will come from direct support for the production of vaccines, I think, through COVAX. There are those that I think are coming through the African Union, where the African Export-Import Bank,
Afrexim Bank, yeah.
Yes, will be working with other agencies to try and provide facilities to enable the AU to give African countries vaccines. And then there's a third element in which we will be trying to look at our own resources and dig deeper to increase the volumes of vaccines that we need. You have to recall that we're a large country with limited fiscal space. So we have to try and find a combination of ways. And as you said, the private sector very much will be expected to weigh in to support giving this vaccinations. I think the key thing, again, the medics know this better than me, is to try and vaccinate as much of the population as possible so that we can begin to achieve some herd immunity, and then so that we can begin to move back to the kind of life that we like to live as Nigerians.
Okay. For those watching us and following us on all our social media channels, you can send your questions. I'll be taking your questions in a bit. We've gotten a couple of them. You can also send your comments with the hashtag COVID1year on all our social media panels. Dr. Ihekweazu, let me come back to you. Which state or part of Nigeria in the last 1 year saw a higher concentration of the outbreak?
So, we produce our data every single night, and from that data, there's no doubt that Lagos has been the most affected state in the country. That's not surprising, being the primary entry point into the country. This virus came from abroad. It's not indigenous in Nigeria, so the entry points are obviously most affected. Lagos also, by its very nature, its high population density, high interaction among individuals, it was a perfect environment for the transmission of this virus. And unfortunately, we've seen a large number of the cases and deaths in Nigeria happen in Lagos.
Okay.
On the other hand, Nancy, just to add this final point, if you allow me, Lagos has also had one of the most robust responses in the country, not only from the public sector, but from the private sector. When you talk about COVID, most of these colleagues are in Lagos. The private laboratories now in Lagos by far outweigh the public sector labs. So by taking off some of that pressure from the public sector, they have responded in a way that only Lagos can in our country.
Okay. Dr. Ihekweazu, I'll still stick with you. Talking about Lagos, let's talk about the Ebola outbreak in Guinea, the recent one now that we're seeing. And you'll recall that on July 20, 2014, Ebola was also imported into Nigeria through Lagos by a Liberian, just like we saw for COVID-19. An Italian national are coming in. Are there actions in place to prevent the entry of Ebola into the country with perhaps what we've learned in the last 1 year, so that it will not be a sorry situation? We're still combating COVID-19. To add Ebola to that will be a very mountainous challenge for us to surmount.
Yeah, absolutely. That Ebola outbreak was really what brought the Nigeria Center for Disease Control into the consciousness of Nigerians. And the reason why the federal government really then realized the importance of having a technical agency with the expertise, resources, and capabilities to prepare, detect, and respond. And we've been taking that mandate extremely seriously. This time, 5 years ago, thereabouts, we had that case. Right now, if there was a suspect case in Nigeria, we know exactly what to do. We already have a preparatory group that swung into action immediately that announcement came. So we have processes in place, preparatory processes, prevention processes first, because we want to avoid having a case. So our port health services are on high alert. We've told them what to do. We have a case definition that has been disseminated. We have lab processes to do that diagnosis if needed. So our response architecture is a lot more robust. A lot of the things we did 5-6 years ago when we had that first case, we learned on the job. Now we have the expertise and the experience to respond more robustly. But Nancy, the important thing to remember is that unlike what happened in Guinea, Liberia, and Sierra Leone, 2014-15, the world now also has a new tool. We have a vaccine against Ebola. It's deployed in a strategy we call ring vaccination. So when there's a case in a village, everybody around that village and neighboring villages are vaccinated to prevent spread. That exercise has already started in Guinea. The best response to an outbreak is to respond where it is occurring. So we're working with our regional partners, the West Africa Health Organization, Africa Center for Disease Control, and the World Health Organization to support the response in Guinea. By limiting the outbreak in Guinea, we prevent exportation to other countries in West Africa, including Nigeria.
Okay, Dr. Ihekweazu, I'll still stick with you a bit because I want to bring in the questions from a cross-section of our viewers as well as on our social media platform. So that I would appreciate if you both can answer my questions in about 30 to 45 seconds. Still with you, Dr. Ihekweazu, which is deadlier? Is it Ebola or COVID-19? Because like I said earlier, we cannot afford Ebola to come into the country. We saw the pictures, like Fela said once, double wahala for dead body. We do not want that double wahala. So which is deadlier?
You know, on the face of it, you would think that Ebola is, because it has an almost a very high case fatality ratio. So a high number of people that get infected actually die from it. So people are very scared of it. But COVID-19 is so well adapted to transmission in populations because of its ability for asymptomatic spread. So people without symptoms can spread this virus, and that is why it has spread so quickly in populations. And if you look at the number of deaths that have occurred, we've just gone past 2.5 million people globally that have passed away. You know, Ebola has never led to this number of deaths. And that's because of this very well adapted virus that causes the COVID-19. And the fact that it is a respiratory virus makes it even worse. So these are two kind of different elements to look at, but sometimes the quiet viruses such as SARS-CoV-2 that causes COVID-19 that appears not to be too bad is really, on a population level, can cause a lot more harm than an Ebola virus.
Okay, Dr. Dipeolu, in the last 12 months, we've seen deaths, we've seen a contraction, we've seen a recession. We're still within a stagflationary environment, higher food prices, rising insecurity. We just saw what happened in Zamfara State. Such a bleak picture in the past 1 year. When you speak with the president, when you and your colleagues speak with the president, and perhaps your colleague advisors, ministers, and all of that, how does the president feel? What does he say to you and your colleagues behind closed doors? Because sometimes with all this, the myriad of economic problems, is the president insulated, and is he feeling the pulse of Nigerians?
Of course, the president is not insulated. Of course, the president feels the pulse of Nigerians. He's a Nigerian, and he lives in this society. I give you one example. Everybody called for the change of security chiefs, and he changed the security chiefs. You know, we all have concerns about how COVID-19 would impact on the rest of us, and how lockdowns, Dr. Ihekweazu spoke about it already, would impact on us. And all those things influence, of course, the reaction. And you hear his positions through public speeches, public statements, press releases, conveying a sense of trying to keep our spirits up, letting us know that the issues are being tackled as best as they can. And there is light down the tunnel. There was an economic response, as you saw in the ESP, which he commissioned. So by and large, he feels that, of course, we are going through difficult times, but he's optimistic that the interventions that are made will help to make Nigeria a much better place.
Okay, at this point, let's get in the questions from our audience, and I'll start with Dr. Dipeolu. A question is coming in from Goka Ayuba. Goka Ayuba, do we have that question right now? Okay, Goka Ayuba is saying, okay, let me take this first. This is coming from Akwere Essien, the founder, Investmill Financial Associates. The daily new cases of the virus during the first and second phases seem to be averagely the same, implying that with or without the lockdown, the virus seems to spread evenly. Based on research conducted by a center, what accounts for this? Question for Dr. Chikwe.
Not true.
So thank you. You know, the different stages of the virus and how it transmits. When it was introduced initially, it took some time to spread, and then we had what we called community transmission. And then we worked very hard as a country with the lockdowns, with people taking measures, and we managed to keep infection levels low. You know, lower, bend the curve, or flatten the curve, as the media called it at the time. But then we warned Nigerians, listen, as the end of the year was approaching, it was almost as if we were held down and we couldn't be held down anymore. And people started celebrating. You saw social events escalating. And we warned Nigerians that there will be a price to be paid. And that's exactly what has happened. In the mix of this, new variants of the virus appeared, and that led to increased transmission. So this is a very dynamic situation. It's not a black or white, 1 + 1 = 2. It's very complex. There are various drivers of transmission, from human behavior to the virus itself to the context in which transmission happens. And that's kind of what has led to this second wave. The good news is that we're now in the 5th week of a week-on-week reduction of cases. It shows that January, February, social activities have reduced for all sorts of reasons. And we're again in a position where even before we introduce the vaccine, we've seen a reduction in cases. The vaccines will lead to even a further reduction. And we hope to keep this as low as possible over the months ahead.
Okay, the question for Dr. Dipeolu comes from Goka Ayuba, and it says hospitality, travel and tourism has suffered a great deal. Recovery has also been very slow. What tangible role is the government playing to revamp the hospitality and travel and tourism sector to restore the enormous losses of the last 1 year? Dr. Dipeolu.
Thank you very much. I agree that that sector really took the brunt of the measures that were put in place to stop the spread of the virus. It is true, but it's also true that government was aware of this, and as much as possible, particularly with regard to the smaller scale players, took action through various means, through the survival fund going to employees, the payroll support scheme, through the enhanced credit facilities that were made available by the central bank. In fact, through also some easing of the absolute lockdown, so that at least you find that some hotels are functioning insofar as they observe the social distancing requirements. Same thing for restaurants. So the point really is that it is true that sector really had a very bad deal, but efforts were made to support them. And I do know that even right now, there's thinking going on how to extend even further support to that sector.
Okay. This other question is coming from AC Okafor, who is the MD, Mark Edu Enterprises Nigeria Limited. This question is for the NCDC DG. With a recent report on the high infection rates in Lagos and some parts of the country, what is the NCDC doing to control the virus with low compliance of the COVID protocol by many Nigerians? That's a very valid question, because some Nigerians, like I said earlier, are having the pandemic fatigue. Not everyone wants to wear a mask now. So how can you still control the spread of the virus?
Yeah, so what we have done is really work together with state government and support their efforts. You know, ultimately, NCDC is not an enforcement agency. Enforcement is a state government and local government responsibility. Lagos State has been doing a lot of work on this within the realities of life in Lagos, as well as other state governments across the country. There have been very many examples set. There have been a lot more deliberate in enforcement strategies over the last few weeks and months. But also, Nancy, to say, you know, enforcement should really be the last resort. You know, most of us are adults. We have to play our part. Leaders in society, in churches, mosques, leaders of organizations, leaders of markets unions. You know, we've really encouraged, and our campaign from the beginning of this outbreak is either we started with take responsibility, we went to celebrate responsibly over the Christmas period, really to focus on individuals taking leadership, owning this response. After all, you know, the deaths that we're seeing are in our communities. We have to take responsibility for our neighbors, for our family, for our loved ones. And so, you know, that's really been our approach, to recognize the ability and autonomy of individuals to do what they need to do themselves to limit transmission from one person to the other.
Okay, Dr. Ihekweazu, still sticking with you. This question is from Deborah Adewale. She's a criminologist, and she asks, was it necessary to wait for the pandemic before equipping the hospitals across the country? And what is the state of our hospitals now? 30 seconds.
Thank you. The demand for resources in our country, you know, I think Dr. Dipeolu will be much better placed to answer this, you know, in terms of the pressure on the presidency, on infrastructure, on road security, all of this costs money. So in a way, of course, my role in the health sector is to keep advocating for more resources to improve our sector. But I also realize the very difficult context in which we work. And we have to continue finding the balance. But I think everybody has woken up to the realization that we've got to invest in developing our health sector to keep us all alive.
Okay, Gabriel Boy is asking on our Facebook, the outbreak of COVID-19 showed how unprepared we are to stand against uncertainties in the health sector, regardless of our experience with Ebola and Lassa fever. With this pandemic right now, are we prepared for future outbreaks? Valid question. He took the question out of my mouth. Have we learned lessons? Are we, and also to add to what he has asked, is there a definitive plan of action in case that we have future outbreaks? Because they must come. Just like a definitive plan of the United States with Dr. Fauci. Dr. Fauci has been there for as long as I can remember. He's like the person taking your position in the United States. So is there a pandemic action plan?
So you see, firstly, on the level of preparedness, I mean, we've seen countries, you just mentioned Dr. Fauci, you know, we've seen countries that we've looked up to for leadership over the last few years struggle. You know, those countries that we have heralded as excellent centers, every country has struggled, because when there's a new virus like this that no one has seen, even if you have expertise and experience from previous outbreaks, every new virus is different. I think what we have done in Nigeria is really, over the past few years, the creation of the NCDC, the resourcing of it, the confidence that our president has had in our ability to lead this response, the leadership of the chair of the presidential task force, and really coming together and saying, listen, guys, run with what you're doing. Yes, there will be criticism. Yes, there will be people that are unsatisfied, but keep your eyes on the ball. And that's really what we've done at NCDC. And what needs to be done, to the second part of your question, moving forward, is, listen, this is not a sprint. You have to build the people. Every organization, like the military, the police, NCDC, is made up of people. People that need to grow in their expertise, grow in their confidence, grow in their skills to do what they need to do. Our role as Nigerians is to support these people to do the best that they can do to keep our country safe.
Dr. Dipeolu, let me come to you with this question. For every opportunity, or for every crisis, there's an opportunity. Have we recognized the opportunities that COVID-19 presented to us, even though 2020 was the year of the pandemic and a lot of bad things happened? But have we found the opportunities there for us economically?
Oh, absolutely. I think we'll start with the health sector, and that we found that we have to invest more in the health sector. We have to invest more in pharmaceutical research and medical research. And so that is one factor. The other factor is that we realize that certain other sectors can be repositioned. So, you know, in the economic sustainability plan about the solar home systems, for instance, that opportunity to begin to give alternative renewable energy to Nigerians. You know, again, about the housing program, to use the opportunity of creating jobs for people on a massive scale to build enough houses to bring down the housing deficit. And of course, you know, in agriculture as well, to use that opportunity to re-energize the agricultural sector and get more credit and more materials and inputs to farmers. So in the response, in the programmed response, we took the opportunity to try and reposition certain sectors while giving support to our people. So yes, the opportunities have arisen also to address some of the previous areas of leakage within the economy.
Okay, Dr. Ihekweazu and Dr. Dipeolu, we have less than 2 minutes to end the show. But Dr. Ihekweazu, this question is from Ali Ubala on Facebook for you. He thinks that Nigeria has the capacity to produce our own vaccine. What are the challenges? Just adding to that, from my own end, is your center conducting studies, or perhaps your sister agencies, if studies are being done right now on those that have also suffered COVID-19 regarding the residual effects of COVID-19? Are there treatments moving forward for those that contract the virus? Must they go to a treatment center, or will there be community treatments or house treatments? In just about 45 seconds, Dr. Ihekweazu.
Thanks, Nancy. I'll take the second part first. There are definitely studies going on. We are looking specifically at repeat infections. So a number of people that have been infected 2 times with this, looking at what has defined that. Our colleagues in Lagos are looking at the longer term impacts of the virus at loose. There's something called long COVID, so those studies are going on. Your first question on our capacity to do the necessary research to be in a position to be players in the vaccine development space. I think there are a lot of upstream initiatives going on that are very exciting. But really, what I want to happen out of this outbreak really is to re-excite young people again about science. You know, we are gone, I think, too far down the entrepreneurial route, and everyone wants to get a business and make money too quickly. I think we need to bring young people back into science, back into the discovery of new organisms, and that is really what will lead us to the stage of vaccine manufacture. Vaccine manufacture is at the end of the road. Okay. What we need is to start at the beginning and to get more people back into science.
Okay, Dr. Dipeolu, what kind of economic recovery is being expected now, bearing in mind that we have fundamental structural factors that are already worsening the economic crisis? Very quickly.
Okay, first of all, just to say that the first thing, of course, is to get out of the crisis caused by COVID-19. And I think we're halfway there just from the rebound that we saw in the fourth quarter of 2020. But going further, of course, is to build the foundations for a solid economy, strengthening the infrastructural base, improving production in agriculture, in solid minerals, in manufacturing, and working together to improve human capital development along the lines that Dr. Ihekweazu just spoke about.
I want to thank you both for joining me today. This is the first of the series, I must say. On the show, we're going to be doing 8 for 1 week, looking at COVID-19 in Nigeria, 1 year on counting the cost, the public dialogue. Thank you both for being on the program today.
Thank you, Nancy. Thank you.
All right, I've been speaking with Dr. Adeyemi Dipeolu, who is the Special Advisor to the President on Economic Matters, as well as Dr. Chikwe Ihekweazu, the Director General of the Nigeria Center for Disease Control, as well as a member of the Presidential Task Force on COVID-19. That is the much we can take on today's edition of the program. Thank you all for being a part of the show. Thank you also to those that joined us on different social platforms. Let's do it again. Monday next week. I am Nancy. You be the best you can be, and but the change you want to see. Don't forget, wear a mask.